I love skincare and I've studied skincare so much. We carry everything that I have looked at and that I have anointed with my blessing. But not everyone will respond to the same lasers or the same skincare in the same way.
Welcome to the podcast, Dr. Ruth Tedaldi. How are you?
I'm great. How are you?
Good. Nice to see you. We have lots of people that want to hear from you today because a lot of my listeners are entertainers and actors. And I think people in general want to ask you this question, which you've answered to me before. How do we age gracefully?
So interestingly, I don't love that term. I don't love aging gracefully.
Okay.
It's used all the time. It's kind of overused. And I think what happens is you become more and more afraid of aging. But I like to talk about it as incorporating aging into your trajectory of life, because the people that are afraid to age basically are afraid of this line or that line. And that's not the way it should be. You know that I speak about the presence, the light that you bring into the room. It's very important to realize that that is not dependent on a line or a wrinkle or a little sag. It's dependent on the gestalt of who you are, what you're saying, and how you're speaking. Some of the most elegant and vivacious, completely filled with life women and men that I know who are over 65 have basically figured this out. And they come in for treatments and little tweaks and little millimeters of change, but they're not distorting their faces to look like they did when they were 30 or 40.
Right.
They want to basically look great for their age, but not erase the signs of the fact that they are now wise and filled with experience that gives them the wisdom to be sought after. So that's the way I feel.
You are speaking our language. Experience, life force, energy, that joie de vivre, that life force, that purpose. That's what we're looking for in actors, that authenticity. So thank you for answering that out the gate, because when you think I'm going to bring a dermatologist on, you think, well, she's going to give us all the Hollywood secrets to staying young. And I'm in a business where we value experience, and method acting is experiencing. So thank you for saying that. Now, having said that, for example, I'm a patient, wink, wink, and I come to you and I tell you that I do want to look my best and be competitive in this industry, which means taking care of yourself and looking your best. So if I came to you on an actor's budget, which of course I've never done that, what would you say to me? Okay, here's the game plan. What would it be?
So the most important thing to address and to incorporate into your daily routine to prevent truly deforming aging is how you take care of your skin. And that is so important. It's never too late. You can always improve things, but that's something I don't go home with you to make sure and reinforce. It's something I educate you about, because you know, and I know that the skincare world is just filled with nonsense. And so you have to understand that protection is absolutely the most important thing. And how often you put your sunscreen on, how often you wear the right kind of hat, not a little cap that looks just adorable, but is going to allow the lateral sides of your face to just become filled with age spots, that you reapply your sunscreen, that you're using something that has 20% zinc as well as some titanium, but UVB is what makes you sunburned or tanned. And we used to love that, but we hate that now, right? It's like looking at someone who smokes, and maybe some of your actors smoke, but obviously That
Yes.
causes tons of lines around the mouth, and the skin ages more rapidly with cigarette smoke and toxins. So, using a sunscreen that has 20% zinc will protect you from UVA that you don't even notice because UVA is that long wavelength that goes through windshield glass. You need at least 20% zinc for that. And using something that has a higher SPF, that's UVB, that's what makes you red and tan. And so understanding that, just understanding that little tweak of what is your sunscreen doing is really important. So how do you do that? You use an antioxidant, you use a retinoid, and you use sunscreen. Basic. And that changes your skin. It makes the pigmentation less noticeable. It makes the collagen thicker, so your epidermis gets thicker. The light reflex changes because all those brown spots are slightly fading. That's so important. But then what do we talk about in terms of what do I do? And I stick those needles or laser you or do all those little things. Less is more. Millimeters of change are really what it's all about. Now, if you came to me and you said, I have all this sagging, you might need something more. I mean, I'm old, and so I do have sagging, but my impression of my face is that, for 71, I'm not bad, and I don't want to look like that, and I
Mm-hmm.
don't want to widen my mouth, and I don't want to feel that I have distorted who I am. So little tweaks, little bits of Botox, so I still have movement but not necessarily a skating rink forehead or no lines around the eyes because that signifies that I'm smiling and participating. And I don't want to erase that. Little bits, tweaks, millimeters, not centimeters.
I love that so much. I mean, we do see people walking around LA that are scary looking. And I'm guessing what happens is if they start doing too much, they forget what they look like. And then that new person looks attractive to them.
Well, there is an entity called perception drift. I don't know if you've heard that about that. But your ability to assess how you look, it's like when you start to diet, you lose a little bit of weight and then you want to be thinner and thinner and thinner. You do an injectable and you go, well, that looks good. I'm going to do a little bit more. And you keep doing it until you get the Kardashian butterfly lip that just looks like a caricature. And so it doesn't look like a human perception of a juicy, voluptuous lip. It looks like something from an anime film or picture. Looks awful.
Exactly. Does it ever make you angry watching television and seeing so many
Not
people
angry.
that
I
look?
mean, I get angry about politics. I get angry about but it's all kind of the same thing. It's it's the miscommunication that shapes our values in terms of our aesthetic obviously is very personal, but it definitely is related to who's educating the person, who's educating the individual. Influencers are become our educators and they rarely know enough. They rarely can give advice that is substantiated by science and or art. So I mean the intersection of science and art is really the basis of what the aesthetic should be, but sometimes there's not enough science. Think about who's doing all the injecting. It's not usually anymore the doctor.
Hmm.
And then think about the art. The art isn't coming from, I mean, look at Meryl Streep's face. Look at people who just look so beautiful, but are slightly older. They have, it's like good wine. The bottom line is it shouldn't be this, I say, it should not be devoid of personality,
Hmm.
beauty.
There is ageism for sure in our industry. I think it's very hard for men and women. I seem to be gearing towards women because I'm a woman. Can we talk about men and self care for men and um, prevention and treatment?
Well, men are probably the fastest growing population in my office.
Hmm.
I think, you could say that they're seeing all these photographs of women attached to them, whether it's mothers, sisters, wives, girlfriends. Um, I think that men have long felt that a rugged kind of a rugged persona is attractive, whereas women don't want it to look necessarily rugged, their face to look rugged. And you could, I'm talking about it in a very binary way. So there are lots of non binary ways to look at
Of
this as
course.
well. And I don't, I happen to be binary, but honestly, I have plenty of patients who are not. And it's the most interesting conversation to have because not every woman wants their lower lip to be slightly bigger than their upper lip. And that's a very Caucasian thing as well. So a woman of color may come in and say, I would like my lips to be equal. And that's a very non-woman of color, man of color entity. So there are lots of ethnic subtleties that are very interesting. There are also lots of gender subtleties that are also very interesting, like the chiseled chin. I can't tell you how many men came after one of the companies launched their new product for jawline, and all they had to use was the word chiseled chin. Problem is, the chin can look more angular, yeah, but then you're putting a lot of filler in the lower face. Your lower face becomes heavier, and that can sometimes be very disruptive to the way the more classically female face looks elegant, which is wider at the malar area, wider at the cheekbone, and then tapering to the chin. So you have to look at the face from all angles. You have to be aware of not just looking at it in a two-dimensional way, because when you look on Zoom, which has become our Bible, right? That's just two dimensions.
Hmm.
So it's very important to have a global perception. I think that's probably true with acting as well. How you
Absolutely.
look on camera when you move versus when you're stationary, it's all related.
Yes, absolutely. And I also feel that as I'm aging, I have a very, very angular face. And so for me, it's about keeping on some extra weight, what I eat, all the insides. I know we've debated a little bit about taking collagen, whether that does anything or not. I'm still taking it, but it is it's a lot. It's all the prevention you give me, and then it's also, I feel like, diet comes into play.
Diet is probably the least well studied and probably most important issue for not only skin quality, but also how we lose collagen, how our skin becomes less buoyant, how we basically navigate all of our systems, our heart, our lungs, our GI tract, probably has a lot more to do with diet than we ever realized. And so, the best simple advice I can give is to just lean toward a Mediterranean diet, lean toward a colorful plate. The more color on your plate, and I'm not talking about day glow yellow from mac and cheese. I'm talking about reds and purples and greens that have lots of antioxidants. And I happen to think that protein is also very important, especially as we get older. So I'm not an anti meat person, but I encourage people to have diets filled with beans and fish and poultry and also meat. So the less processed food you eat, the more healthy you will probably become.
Okay. And this is something we can all do. I know when I was struggling as an actress in my early years, it was hard to eat healthy food on my budget, and it was easier to, grab a little burrito or something, inexpensive and really not so great for your skin. I think I have all these questions whether it's really making a difference, but probiotic yogurt I do a lot of vegan protein, but I feel like the probiotic yogurt has been really good for my skin. And I can only judge by trial and error taking omega vitamins. Is that something you would recommend?
Well, omega-3 vitamins are definitely helpful to to all your systems. I think that the microbiome is really hot right now in terms of how it affects our skin, how it affects the way we age. Tuning in to the normal bacteria that we carry, protecting it, stimulating it, pushing that, and that's what a lot of yogurt is all about in terms of maintaining that microbiome. That's very important. All of the organisms in our body are in balance, and so as soon as we which is what antibiotic therapy is all about in terms of disrupting that. But as soon as we basically play with it too much, we probably shift it to a place that is not as healthy. So I think that taking a multivitamin is good. Having a diet that provides that is probably even better. And I think that we can all learn so much by tuning into everything that is now really in the forefront of medicine, which definitely includes nutrition.
Okay, great. I have one more question for you. So, what is new and exciting if I came into your office today? I mean, I think most actors are doing Botox and filler. Is there anything else that's on the horizon?
Oh, there's so much. There's so much new. There's so much. Um, we just purchased a new ablative laser that is a really nice CO2 minimally or maximally ablative. What ablative means is it's taking off layers of skin and stimulating the healing process, which is in right balance. Definitely a good thing for rejuvenation. But I think that every office, you have to be very careful and suspicious because when an office buys one of these lasers, they spend a lot of money on a good laser, hundred to $200,000. And so they're going to push that. And it's like what I say to you about the office that carries 3 different brands of skincare. They're going to push that. I prefer to be the genius bar with my patients and say, this is really the best because I love skincare and I've studied skincare so much. We carry everything that I have looked at and that I have anointed with my blessing, but not everyone will respond to the same lasers or the same skincare in the same way. So I think this is where the relationship that you have with your doctor is so important because it's based on honesty and the ability for the patient to say, I tried that, it didn't do anything. If that's a laser, sometimes it's the way the laser's used. If that's skincare, often it's because you're not using it for a long enough period. You really have to give it a chance. And we talk about the graveyard of skincare. People try something for 2 weeks. If they don't see enough response, they're going to go on to the next. And usually going on to the next is another product that's not going to work in 2 weeks because that's not the way products work that work. It takes a much longer period of time.
Right.
So you're going to hear about lots of different things going on with skincare. You're going to hear about exosomes, the way we basically position different proteins and growth factors to truly stimulate our slightly less active fibroblasts, the cells that make collagen. You talked about oral collagen, which I'm still on the fence about, to be honest with you, because I've read everything and nothing really screams to me that it really necessarily does that much. But I do think that minimal um, minimal abrasion to the skin to turn on the healing process is helpful. I'm not a big fan of really using machines and technology that are too strong and have too much downtime. I don't like to burn the skin. I don't like to scrape the skin off. I like to be gentle with it and give it a chance to work.
Okay, I'm glad you say that. One of these days, I'll tell you my story about burnt skin. Uh, not a pretty one. Where, how, when can we get you out to Hollywood?
So my practice is in Wellesley, Massachusetts, and my practice is called Dermatology Partners. And you can find me on Instagram at Tedaldi Treatment, Tedaldi Treatment. And that's probably the best way to DM me, through Instagram. I'm not a monster Instagram user, but I will respond to you, and I'm happy to answer your question. Thank you, Rachel.
Thank you. It's wonderful having you. And I highly recommend Dr. Tedaldi. Get in touch with her. She's worth the trip to Boston. Hopefully, we can get her out to Hollywood one of these days. So nice talking to you. Thanks for all the tips. We're all going to look authentically beautiful because of you. Thank you.
Au revoir.
Au revoir.
Thank you, Dr. Ruth Tedaldi. Lots of inspiration there and wisdom. And of course, if you're on the picket lines this week, be sure to reapply that sunscreen like Dr. Tedaldi suggested. If you'd like to hear more of these podcasts, please visit my website at diaryofanactress.com. Until the next time, stay inspired.